everybody. Welcome to Autoimmune Table Talk today. And today's hot topic is, do you think doctors are trustworthy? And this was hot topic. We posted this question in our Facebook group, Transform Autoimmune Disease Naturally. And lo and behold, within, I think, 48 hours, we had over 200 comments, and we're near 300 comments now, just about 3 days later. And people had a lot to say about this topic, and I'm just gonna give you guys some of the feedback and some of the comments that some of you guys have been giving here. For those of you who are just joining us, I'm Dr. Maggie Yu. I'm a functional and holistic medicine physician and owner of Transform Autoimmune Disease Naturally. That's also the name of our Facebook group. We have an online program to transform autoimmune disease naturally. We also have a hormone balancing program called My Hormone Masterclass. Well, the hot topic came up because I think that the way that there are complex disease states, right? So we're looking at complex disease, chronic diseases, for example, like autoimmune disease, cardiovascular disease, cancer, Alzheimer's, Parkinson's, dementia, diabetes. There's a lot of chronic diseases, which many of us have with many different types of symptoms. And I think the frustration that a lot of people are finding is a lot of times the blame is, oh, doctors aren't trustworthy. But this is a much deeper dive conversation into this. So what I'd love to do is, wherever you're watching from, if you're on Instagram right now, make sure you subscribe to our channel. YouTube, same thing, subscribe to our channel. If you're watching this on Facebook and you haven't joined our Facebook group, why don't you click the link or look for Transform Autoimmune Disease Naturally and join our group. Those of you that are watching right now, please in the comment section tell me what you're watching, where you're watching from, and tell me, do you think doctors are trustworthy, okay? And those of you that are alumni in our programs, if you have your experiences about doctors, whether they're trustworthy or not, what your experience with our program is, or different forms of healthcare delivery is, go ahead and comment in the comment section below. All comments are welcome. Why don't you join the conversation right now? All right, so I'm just going to go over some of the comments that came out of the group so far. Monica W says, I think most of them believe that traditional prescription medications are the answer to most medical problems, which is the only thing they're taught in medical school. Good point, Monica. I think you're right. So there's some issues with training here. They're only doing the only things that they know how. So you think you're going to a doctor and you think they have every tool, but in reality, they're trained in a very narrow set of tools, and that's all you're going to get. So you go there with a complex problem, like I have lupus, and you think they know about nutrition, they know about lifestyle, they know about herbs, they know about alternative therapy, and the answer is no, they don't. Monica W, I think this is a really great point, which is that they really think that they think that medication is the only answer because that's the only training they have. That is the training we have for doctors. So this is an interesting point. I'll expand upon it more. Melissa P says that it depends on the doctor. Some of them literally don't care how you feel, and as long as your blood tests are normal, then that's it. It's really frustrating. So conventional lab values is the other part Melissa P wanted to bring up. Good point. Gregory says, doctors overall seem very trustworthy until you have or understand the data and the mission of our healthcare system, which is to ask, when you ask questions, the only thing that they do is they diagnose, medicate, and move on. Okay, so doctors aren't here to heal you. They're here to make a diagnosis and to medicate you, and then it's next. That's Greg's point. Is that your experience? Why don't you type that in the chat? That would be great. And then here's Jessica M, who is a graduate in our program. She said, once I decided to be the CEO of my health started to recover. Awesome. Okay, so we'll talk about, are there alternative ways? Can you become the CEO of your health? Do you have to be fully only dependent on doctors? So that's an interesting take, Jessica M, which is, when I become the CEO, the person in charge of my own health, everything changes. But how do you do that? Okay, good point. Heather says, I think the U.S. healthcare system is not trustworthy anymore. Healthcare system problem. It has turned into a huge business. So there's a lot of people, financial interests, with too many limits on what doctors are told they can and can't do. So it's not really about the health of the patient. There's a lot of rules and regulations, and there's a systemic problem. That's what Heather says. So healthcare system sucks. Artemisia says, I don't trust the healthcare system. Some doctors are good and some are not. I feel like all they want to do is push pills. Not really here to help you get well. Okay? And it's also just a big guessing game. Well, with autoimmune disease, when it's either they diagnose you, if you're lucky to get a diagnosis, and then they treat you, if you don't fall into that treatment guideline, it is a guessing game for them. They don't have anything else to offer you, so there's a lot of guessing. And if you don't actually fit in a diagnosis box, then it is a wild, wild west out there of guessing, right? What do we do with people with no diagnoses? And even if you have a diagnosis, how many different other symptoms do you have that they can't explain? So this is a big guessing game is the problem. Okay, Joel says, I trust very few doctors. In medical school, interns are taught to keep emotion out of their practice and caring as an emotion. Doctors are literally instructed to not care about their patients. Joel thinks that doctors are trained to just be objective, diagnosticians, and not to attach or care. Okay, that's a perspective and that's an experience, okay? Is that your experience? Can you comment in the section below? Okay. Kelly says, how can you trust a doctor who doesn't care? Today I experienced another swift kick in the gut by a conventional doctor. Basically, washed his hands of me and passed us along in a 15-minute telemedicine visit with my $50 copay. So, a lot of frustrations here, all right? And I mean, I'm sensing that there's multiple layers, right? Some people think that doctors don't care. Some people think their training suck. And some people think the healthcare system sucks. So it's a much bigger question is, are doctors trustworthy? Because I think on the whole, when you actually look at all the comments, people feel that doctors are caring, that most doctors anyway, are caring individuals, right? But the problem is there's just a lot of systemic other problems. So I'm gonna give you guys the lowdown, okay? And this is my own story and my own experience about this, which is that as a conventionally trained doctor, graduating out of one of the top medical schools in the country, I think that the only thing I was really taught was how to, diagnose something and what medication to treat. And when I tell people to guess, okay, and I'm just gonna ask you to guess right now, guess in my 4 years of medical school, okay, how long did I spend on nutrition, alternative therapies, lifestyle? How long do you think I actually really spent on this? Just think about nutrition. How long do you think I spent on nutrition in 4 years of medical school? People who've heard me talk about this is, I'm being really honest, 30 minutes. So really, in medical school, one of the top medical schools in the country, I spent, literally almost a year and a half in pharmacology, how to prescribe drugs, and then another year and a half just to actually prescribe it in the hospital setting. But how long did I spend on food and nutrition, learning about it? 0. How long did I spend on supplements? Well, no, food and nutrition, 30 minutes. How long did I learn on supplementation, natural herbs and remedies? 0. So kind of think about this. The entire training of all the doctors that you're seeing is really just on diagnosis and medication, or diagnostic testing and medication, or surgeries. And if you don't fall into a clear diagnosis and you don't fall into a clear, guideline of which medication or surgery you're going to do, what other tools do they have to offer you? They really have nothing to offer you, even with the best of intentions. So my story around this is, until I got sick, I was a family practitioner, and I worked for two of the largest medical groups in this country, and I basically was an expert. I was a great family practitioner, great diagnostician, and great at dispensing medication, great at saying, I'm right on this, I don't know what you to do with that, send you to the specialist, really good at just categorizing and passing people along. Because you know what, it's like, the compensation model and the way the healthcare system is structured, we basically had to see, 20, 30 patients in a day. And yes, I would spend, if I'm lucky, 15 minutes with you. But if I'm lucky, I only have to spend another 15, 20 minutes that night charting on your chart. And therefore, it was like, we're lucky we get out of the room alive sometimes, and because we're trying to get out of as many, while I'm sitting here diagnosing you and giving you the treatment, there's 2 or 3 other people waiting for me. So good intention, well-trained physician, but the fact of the matter is, we're paid on volume. We're paid on volume. We're not paid on actual quality of health outcomes. Okay. And so it's not that I don't care or we don't care, it's that we are trained to actually be almost like mechanics doling out like parts, body parts and treatments to people. And we're actually compensated to churn through as many people as possible. So in that system, and most of us are employed, most doctors are employed. Most doctors don't even own their own businesses. So we're being told what to do and how to do it. And I call it factory medicine. And then I got sick. When I got really sick, and I got sick with really complicated stuff, then there was nothing they could do. They offered me antidepressants, pain medication, therapy, because I was cuckoo then, because there's a problem they can't solve. My labs were normal. So, I became my own worst nightmare patient. But in a way, if you think about it, the only reason at this point that I was able to actually solve some of these really mystery and big health problems is I had to receive really bad care that I delivered. That sounds so bad. I had to receive really bad care that I delivered. That is actually the gold standard of care. But the gold standard of care, your guys are right, that are not trained to deal with chronic diseases and complex diseases like autoimmunity, major hormonal issues, cancer, cardiovascular disease, dementia, you name it, right? So I think that you guys are onto something here, which is that the problem is we have trustworthy physicians. Their training really sucks. The compensation with them as employees is for them to churn out volume. And then number 3 is they don't know what the hell to do with really complex medical problems like autoimmunity. So I think the moral of this is, what did I have to do to actually cure myself? Is that I really had to go outside the system. I had to spend my own money, a lot of it, probably $500,000 just in the last 10 years in my own education. That was not paid for by anyone else. It had to be on my own time, my own dime, right? And then I couldn't operate and choose to practice this kind of medicine, which is root cause medicine, in a 15-minute factory medicine model. So I had to go outside of the model. I really did. And that's why we have an online program. And for me, I think a bigger issue is that we don't educate doctors and we don't educate patients. So for me, like when Jessica M, going back to the comment, she's an alumni in our program right now. She says, when I became the CEO of my own health and I took charge, then everything changed. But what that means is that you as a patient need to understand that you have to learn with an educational model actually how to be the CEO, the person in charge of your health, which to me is the whole trustworthiness. We got to train more trustworthy doctors with more tools and better training and create better systems outside the factory medicine model that actually can deliver an educational model to teach patients how to be in charge of their health. And that actually can train patients to self-trust. You can be trustworthy. But it's about education all around. Doctors have to get educated and you have to get educated. So it's a very complex picture, and I totally agree. I think doctors in the majority really do care. I really care. But the fact of the matter is, until I got really sick, and I didn't have any choice but to invest in my own education, with my own dime and with my own time, there weren't solutions for me to gain the knowledge that I needed to become a trustworthy physician. Wow, that's a truth bomb right there. Is this resonating with any of you? Does this make sense? So the way to actually create trust with yourself and the way that we can train more trustworthy doctors is an educational model around root cause medicine. What's causing the problem, not just what's band-aiding it. And to me, that takes a lot of time, that takes a lot of money for the physician or the patient to do that. But is it worth it? The answer is it worth it? Absolutely. I trust myself. And it sounds strange, but I haven't seen a doctor in about 10 years, maybe except for the pap smear, because it is really even hard for me to find physicians that really understand seeing me as a whole person and looking at one symptom, let's say I have pain, and understanding there's multiple factors that contribute to it. It's been impossible, and it's been pretty impossible for me to find one physician MD trained anyway to actually be able to address those issues. So I've learned to trust myself, and I love the fact that I'm able to teach people how to do that now. But you got to go outside the current existing conventional medical model, and that is why Transform was born. That is why my journey of why I became a physician, a functional medicine physician, because I had to treat my own illness, and then I couldn't operate as a physician in the conventional model anymore and be a hypocrite. So I had to break out of that and create a whole online model of education around teaching people how to transform their autoimmune disease naturally. Okay, so I hope that helps shed some light on why we don't trust physicians out there, and there's a lot of deeper questions that need to be asked and answered, but I really think that an educational model is key. For those of you who are already in our Facebook group, why don't you join, go to the units section. There's a lot of sections where I teach through some of the fundamental pieces that cause autoimmunity and how you can deal with them. For those of you who haven't joined our Facebook group and you're watching from Instagram or YouTube on Facebook outside our group, join our Facebook group, Transform Autoimmune Disease Naturally. And you can check out our website, drmaggieyu.com, to check out what it is that I do and what is an educational model that's done online. What is community and group medicine done in a group online? Learn about it. Join our Facebook group. Have a great night, everybody. I hope you enjoyed that. And if you did, I would love it if you actually, in the comment section, tell me what the biggest aha was for you in this behind the scenes look at my take on why we perceive doctors as not very trustworthy, or and what the underlying problems are. If you can tell me your biggest aha, that would be great. Okay, everybody, thank you for joining me on another episode of Autoimmune Table Talk. Thank you for playing full out in the Facebook group and answering the questions that we pose for you guys every week. If you're watching this on Instagram or Facebook after we went live in the Facebook group, this is going to be public after we go live in the Facebook group. Once it's public, feel free to share this with anyone by putting their name in the comment section. That'll be great. Sharing is caring. They may not listen to you, but they may listen to me. All right, everybody, have a great day. Thank you.